3rd, 2025. The chair recognizes the gentleman from California, Mr. Carbajal, for 30 minutes.
Thank you, Mr. Speaker. Today I rise on behalf of the Congressional Hispanic Caucus. A number of members are going to come and provide testimony tonight about what we perceive is a betrayal of our colleagues on the other side of the aisle, of the American people, with the recently passed budget resolution that really is going to provide tax breaks to the wealthiest Americans in exchange for cuts in vital, essential programs for working middle-class families. Mr. Speaker, I yield myself as much time as I can consume. Thank you, Mr. Speaker. I am proud to stand here with my colleagues from the Congressional Hispanic Caucus to call out the partisan Republican budget resolution that passed last night for what it is. It is a ripoff of the American people. Their budget proposes reckless spending to support billionaires and makes everyday Americans foot the bill. It cuts over $1 trillion, including $880 billion from Medicaid, in order to partially pay for trillions of dollars in tax cuts for the wealthiest people. These tax cuts would not go to help everyday Americans. Instead, they would go to the richest 1%. Apart from that, it also increases the deficit and the national debt to the tune of $4 trillion. What happened to fiscal responsibility? This is a betrayal of the American working middle-class families. There are 80 million people in this country that rely on Medicaid. In my district alone, over 236,000 people on Medicaid are at risk of losing their health care. This includes nearly 100,000 children and 24,000 seniors. Not only that, but the budget resolution would also go after the Affordable Care Act again, and is projected to raise annual health premiums by roughly $1,200 for 20 million people. It would force 7 million Americans to lose their health insurance. This budget resolution does nothing to deliver on the current needs of the American people. As inflation continues to grow and threats of trade wars persist, the cost of necessities like groceries, childcare, housing will continue to increase, putting a greater burden on American families. Their budget resolution also earmarks $200 billion to supercharge mass deportations that go beyond violent criminals. Make no mistake, under this plan, we can expect even higher prices for food and goods, and it further worsens our workforce shortages. The reality is that undocumented workers make up 14% of construction workers and roughly 42% of our agriculture workforce. Mr. Chair, to help everyday Americans instead would go to the richest 1%. This is a terrible circumstance. Mr. Speaker, I now will unite to yield to my good friend and chairman of the Congressional Hispanic Caucus, Mr. Adriano Espaillat.
Thank you, Mr. Speaker. Thank you. I ask for unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and submit strenuous materials into the record. Thank you, Mr. Speaker. Today, the Congressional Hispanic Caucus comes to the floor united as one unit against this Republican budget resolution that slashes at least $1 trillion, that's right, $1 trillion with a capital T, dollars from Medicaid and other essential programs to the American people, to working class families, to seniors, to children, threatening 80 million individuals. This is a matter of life and death, Mr. Speaker. It's a matter of life and death for our communities. At the very least, 20 million Latinos, about 1/3 of our folks, rely on Medicaid. More than half of the Latinos on Medicaid are children. They depend on it. Many of them are asthmatic. And they will now have to face a precarious situation where they may get an asthma attack in school, and maybe that school-based clinic is not open for those critical first minutes of aid. Many of them are diabetics, and they rely heavily, obviously, on insulin. And they may not have the Medicaid coverage for insulin to save their lives. So this is a matter of life and death, Mr. Speaker. This is not just a regular bill that we do on this August body to feel good or to maybe take care of a specific issue in a particular state. This is a matter of life and death. And you have Latinos with renal problems, with cardiovascular problems. High blood pressure is an epidemic, is at epidemic levels in the Latino community. And this bill, again, presents a situation or life or death for many of their constituents across the country and the ones that I represent in New York's 13th Congressional District, where over 500,000 residents of that district rely on Medicaid. Over 100,000 relied on Medicare. So over 600,000 of the 780,000 people I represent are either on Medicaid or Medicare. And this bill presents a clear and pressing threat to their health and to their lives. In addition to that, Mr. Speaker, Republicans also seek to cut $230 billion in nutritional programs like SNAP, food stamps. That's right, food stamps are being cut that currently aid 10 million Latinos, including 5 million kids. These nutritional programs are essential to their health and growth. And so we're here pushing back on the cuts to food stamps. In my district, Mr. Speaker, there are over 200,000 households that rely on food stamps. If you multiply that by an average of 3 people per household, you can do the math and you can see that it will devastate that community. And this bill, this proposal by Republicans seeks to cut $230 billion in nutritional programs. The $200 billion in this budget also seeks to supercharge Trump's massive deportation plan, which will disseminate the agricultural workforce by 16% and lead to increased food prices. You can expect food prices at the cash register, at the supermarket, to go dramatically up. This is egregious. And we are united in opposition to this betrayal, the Republican budget betrayal. The Congressional Hispanic Caucus stands at once and together in opposition to this Republican budget betrayal. CHC is committed to protecting dreamers. Those are young people, on an average, that have been in our nation for over 20 years. They are nurses, teachers. They are bus drivers. They are members of the armed forces. They own their own small businesses. They own their own homes. And yet, we cannot get to regularize their status. We support dreamers. We are in support of farm workers. They pick the crops and the fruits that come to our dinner table, and many of them are staying home in fear of being deported. You can expect food prices to go up. And of course, we are in support of keeping families together. A family that's divided, when a mom or a dad is split from his or her children, that family is a weak family. They become vulnerable, and that translates into a weak nation and a vulnerable nation. So CHC, the Congressional Hispanic Caucus, is in support of dreamers, farm workers, and keeping families together. Latinos voted in favor of lowering costs and increasing wages. The budget passed last night only gives billionaires tax cuts and funds indiscriminate raids in our city, all paid for by working class family. Again, Mr. Speaker, CHC stands with our community and rejects the Republican budget betrayal. Now, Mr. Speaker, I yield back the remaining part of my time, and I yield back to Congressman Carvajal.
Thank you, Mr. Espaillat. Before I yield to our next speaker, I wanted to reiterate, make no mistake, under this plan, we can expect even higher prices for food and goods, and it further worsens our workforce shortages. The reality is that undocumented workers make up 14% of construction workers and roughly 42% of our agricultural workforce. Farm workers help feed our nation and allow grocery stores to stay in stock with affordable fruits and vegetables. Unfortunately, this reality is not what my colleagues on the other side of the aisle want to admit. On Monday, I offered an amendment to the budget resolution so we can move forward the bipartisan Farm Workforce Modernization Act to provide farm workers with legal status so they can continue to work on our farms in this country. Not only is this the right thing to do, but providing farm workers with legal status helps provide stability and keep our stores stocked with affordable groceries and domestically grown food, also helping American growers. Instead, the Rules Committee blocked my amendment, and not a single amendment was made in order. We need to do better than this and deliver on lowering costs for American people. I call on my colleagues on the other side of the aisle to reconsider this reckless plan that would benefit billionaires at the expense of everyday Americans. With that, how much time do I have left, Mr. Speaker?
The gentleman from California has 16 minutes remaining.
Thank you. I now yield to the gentlewoman from Washington, Ms. Emily Rendell, for 5 minutes.
Do I do it from here? Okay. Thank you so much to my colleague, Mr. Carvajal, and thank you, Mr. Speaker. I'm learning how this works here, so thanks for your patience. I come before you today to tell a very personal family story that motivated my interest to serve my community here in Congress, and that continues to motivate me to think about the impacts on families all across my district and all across the country When I was 7 years old, my sister Olivia was born with microcephaly. And what that means is that her brain was small and the doctors didn't know why. They didn't know if she would live, how long she would live, what her life would look like. And I grew up in a family of public servants, a bipartisan family, a biracial family, and my dad, who was a civilian employee for the Department of Defense, had pretty good government employee insurance, but that insurance wouldn't have covered all of the surgeries, the specialists, the equipment that Olivia needed to thrive. But gratefully for our family, the Washington State Legislature in 1993 voted to expand Medicaid, one of the first states in the country to lead that charge. And for us, that meant that we didn't have to worry about losing our house or what other bills that we would pay, so that Olivia could survive and thrive. It meant she was able to get multiple wheelchairs and use equipment like an inflatable vest that kept her from getting pneumonia more than 5 times a year. She was able to go to public school and live for 19 years with our family. For me, I learned that government could be a safety net for families like mine. And for the last 6 years in the Washington State Legislature, I've worked hard to expand healthcare access for folks all across the state and all across my big rural district, where hospitals are already struggling because Medicaid reimbursement rates are low, where small clinics, independent providers are shuttering their doors because they cannot afford to stay open. So, if you have a family with a disabled kid like my sister and you live in Nia Bay, the farthest northwest corner of the lower 48 states, you have to drive hours and sometimes wait for a ferry that's 2 hours delayed in order to get to a specialist in Seattle to get your kid life-saving care. What will happen if this budget resolution becomes reality, if $1 trillion is cut from Medicaid programs, we will see potentially per capita caps. What that means is that we will decide how much the lives of children like my sister are worth. How much will we be willing to pay for the equipment and the specialists and the surgery to keep alive medically fragile kids? It will mean that folks without disabilities, seniors, and low-income children, folks with private insurance will struggle to afford health care in communities like mine and communities across the country. We are facing a real crisis in our healthcare sector already. We should not be adding to it by cutting $1 trillion from poor people and people with disabilities, from children, from seniors who are often dual eligible for Medicare and Medicaid, who are able to live in dignity to the end of their days because of this important program. It will keep long-term care programs open if we are able to maintain Medicaid funding. I'm scared. I'm scared for my constituents. I'm scared for my neighbors. I'm scared for the healthcare providers that are just trying to do their jobs. And I'm scared for the impact that we will see for years into the future if this budget resolution becomes law, if we deliver these trillions of dollars of cuts for families who depend on Medicaid. Thank you so much, Mr. Speaker, and I yield the remainder of my time to Mr. Carbajal.
Thank you. Thank you. Mr. Speaker, I now would like to recognize the gentleman from New York and chair of the Congressional Hispanic Caucus, and my good friend, Representative Adriano Espaillat.
Thank you, Congressman Carvajal. Again, Mr. Speaker, we have stood here tonight to warn the American people of these massive cuts in vital programs like the Medicaid program and SNAP, the food stamp program that provides nutritional assistance to our families, as the Republican majority perpetrates a scam to provide the very wealthiest of Americans a $4.5 trillion tax cut at the expense of the health of the American people by cutting Medicaid, a vital program for Americans all over the United States, not just urban areas, but rural areas, suburban areas, from the north, the south, the east, and the west of the country. Americans will be dramatically impacted by these cuts. This is not a Republican cut or a Democratic cut. It will impact people across the aisle. Republican members have many constituencies that are on Medicaid and Medicare and receive SNAP benefits. And yet, the savings will go to the fat cat executives and shareholders, the wealthiest in America. So we're asking for the American people to be alert of the Republican budget betrayal, that it is a life or death matter, puts their life in danger by denying them the basic health care benefits that they're entitled to. So, Mr. Speaker, we stand here as one, members of the Congressional Hispanic Caucus, to say no to this plan and to tell the American people that they're not alone, that we're with them in good times and in bad times. And I move that the House do now adjourn.